Welcome back to Good Day Columbia. Time now is 7:13. This morning, we're learning more about colorectal cancer. According to the Centers for Disease Control, data shows that in 2022, nearly 148,000 people reported cases of it. In 2023, nearly 54,000 people died from this type of cancer. Now, just last week, a former Gamecock quarterback Stephen Garcia revealed that he had been diagnosed with stage 4 colorectal cancer, and he started an aggressive treatment regimen. A GoFundMe has been created to help Garcia in the battle. Here's a recent message he posted onto his official Facebook page just yesterday.
I appreciate every single one of you guys reaching out to me at all times. It is severely uplifting, and I appreciate y'all. I love y'all. Quarterback your health.
At Quarterback Your Health, joining us now to further discuss this type of cancer is Dr. Conigliaro Jones with the TLM Medical Services. Dr. Jones, thank you so much for being here.
Thank you for having me.
And we have to also just have this disclaimer out to our viewers that some of the information that we're going to talk about can be graphic. We know it's early in the morning, but we just wanted to give you all that disclaimer. First of all, Dr. Jones, let's get straight to it. What is colorectal cancer?
Colorectal cancer is cancer that's basically confined to either the colon or the rectal part of the body.
So how is it formed, or what are the risk factors? How can someone get this?
Yeah, that's a great question. It's difficult to say exactly what causes it, but we know risk factors include family history is number one. Number two, we know diet and activity play a big role. Unfortunately, now our diets are full of saturated foods and high fat foods and things like that. So fruits and vegetables and things like that do play a big role to help prevent.
So what are some of the symptoms to watch out for? And I know we have a few that we're going to list for folks to see so they could get a better understanding at home. Some of these symptoms are, Doc, as we talked about before, to kind of talk to us about these here.
Yeah. Unfortunately, most of the symptoms you don't get or recognize until the disease is kind of later in its phases. So diarrhea and or constipation, changes in your bowel habits. Blood in the stool is a big one that we've been testing for many years. Abdominal discomfort, I know that's very vague, but unexplained.
Right,
a lot of you have stomach pain a lot of times. That doesn't mean you always have abdominal cancer or colon cancer, but it is a risk factor. And unexplained weight loss, obviously, is another one. And again, unfortunately, you don't find those symptoms until later.
Okay. So as we are talking about this, Dr. Jones, is there a treatment? Is this cancer treatable?
Yeah. Like we were just mentioning, exercise, keeping your weight in a good range, staying active, and diet is probably the biggest thing that you can do to actively play a role. Reducing alcohol consumption also makes a difference, and of course, tobacco products. Those are risk factors.
You know, speak to that aspect right there, Doc, about getting checked. Is this something that if somebody's getting, for instance, like right now, there's a push to get prostate cancer checks earlier. There's a push for a lot of these cancers early on. Is this something that people should start looking at an early age?
I think you should definitely be conscious of it. Family history matters. So the average age, just so you know, of having colorectal cancer is mid-60s. So most insurance companies were screening starting at the age of 50. And now, recently, a few years back, they dropped that age to 45 because so many younger people were having this condition. So being mindful, looking for any of those symptoms, you know your body, look for any of those changes and things like that, and talk to your doctor.
That's pretty interesting, Doc. You mentioned about, you know, in the 60 age range, because we know the former quarterback, Stephen Garcia, is not at that age at all. For young people, what should we do if we're feeling different, I guess? What should we do to protect ourselves?
First thing, if you know, get to know your doctor, get a primary care doctor, and start going, and when you start having symptoms and things like that. And you're right, this is becoming more and more of a younger issue. And I think the biggest driving thing for that is just our food consumption. It's like the types of food, high fat diet, we're like fast foods and things like that. We need to get back to more fruits and vegetables, stay active, keep our weight in a good range, reduce our alcohol consumption, and tobacco products, of course, increases most risk for cancer.
And for those of folks that are just joining us, we just want to make sure you know that, of course, Dr. Jones is not treating Stephen Garcia. Garcia. He's just on the show to talk about colorectal cancer in general and certain things that we have to understand. That's why these questions are very generic and not specific to one person. So Dr. Jones, once again, so if someone finds out that they are diagnosed with colorectal cancer, there are different stages of it. I guess
Absolutely.
What makes it stage 1, stage 2, stage 3, stage 4?
Yeah. As soon as you get a diagnosis with a colonoscopy and getting a biopsy done, once you get that done, then you go through what's called staging. And so you'll get with your oncologist and your gastroenterologist, and we'll do imaging tests to see exactly where that cancer is located. Has it spread to different parts of the body? Is it localized? What part of the intestine is in? So mostly scans and things like that, getting blood work to see exactly where you are health-wise.
And it's not, and it's kind of difficult to give a timetable, right? If someone's diagnosed.
Yeah, because everybody's a little different, and getting diagnosed depends on how far advanced the condition is. And like I said, unfortunately, most people don't find out that they have this until stage 2 and stage 3, and sometimes stage 4.
Well, Dr. Conigliaro Jones with TLM Medical Services, thank you so much for being here, Dr. Jones.
Thank you. I appreciate
your expertise. Thank you so much.
Right.
Stay with us. There's more Good Day Columbia coming up after break. We'll get a check with Chief Meteorologist Taylor Canoose.